Dr. Bruce Vanderhoff explained vaccination rates are dropping in Ohio, especially against the measles. The biggest age group impacted is incoming kindergartners.
My question is, why would we not want to protect our kids from measles? The recommended two-dose regimen for children has been proven to be 97% effective at protecting against measles.
And while this year's outbreak hasn't hit Ohio yet, you will remember there was an outbreak back in 2022. The Ohio Department of Health reports 94% of those infected were unvaccinated, and most were in the recommended age range to receive the vaccine.
And we also know it is very safe. There have been some spurious claims in the past that the vaccine is connected to autism, but those claims have been debunked.
Here's what health experts want parents to know. It is recommended to get your child their first dose between 12 to 15 months, and then the second dose between 4 and 6 years old. Dr. Vanderhoff also wants to remind people that this disease is serious.
You can get measles literally by just being in a room where a person with measles has been recently. This can happen even up to 2 hours after the person has left.
Measles symptoms include a fever, cough, and runny nose. And then as it progresses, you see those tiny spots inside the mouth, the tiny white spots, and then the red bumps on your face and limbs.
It's a tiny virus, and so it can actually stay suspended in the air in little water droplets. So, when you cough into your hand gets a little bit wet. Those are little water droplets, and they can actually hang in the air for quite a while. And the measles virus isn't heavy enough to make them drop down to the floor.
Now, that first dose of the vaccine is 93% effective. And then the second, experts say, is 97% effective. It is given as part of the measles, mumps, rubella vaccine, or MMR, to babies when they are 12 to 15 months old, and then to children who are 4 to 5 years old.
So doctors say we could start to see more cases in the next 3 weeks because that's typically how long it takes for the measles virus to show symptoms. Now, symptoms start showing about 13 to 14 days after exposure. And if you come home from vacation and immediately get sick, doctors say it might be connected to a potential exposure. When symptoms start, people are contagious between 4 days before the rash through 4 days after the rash. If your child appears sick 2 to 3 weeks after returning home from spring break, doctors recommend to keep your kids home. And we cannot stress this enough. Measles is a very contagious virus if not vaccinated, and you can even get it by just sitting in an airport.
You may not even know that you're exposed, right? You could sit down at a table in an airport food court and the family who just got up and left, and you wouldn't even know. So you're right. You may not know. In terms of other ways to protect yourself when traveling, good hand washing, trying to avoid touching your mouth and nose or rubbing your eyes, making sure that you wash your hands well after you go to the bathroom, wash your hands well before you eat or drink. Just make sure that you're kind of cleaning surfaces as much as possible and keeping your hands clean and away from your face. And if you do get sick, you want to stay home.
So what should you do if you show symptoms? Doctors say call your primary care doctor or go to the emergency room, but let the provider know you think you might have been exposed to measles before coming in for your appointment. After that, follow doctor's orders, which typically involves quarantining. If unvaccinated Ohioans have been exposed or traveled to areas where outbreaks are occurring, Dr. Britt Mitzman is predicting we could start to see this surge the beginning of May. And if you are not vaccinated, get vaccinated. That is the easiest way to prevent getting sick and the best way to help stop the spread.
Can we go ahead and get started by having you talk about how many cases of measles you currently have there in Knox County?
Hi, Tracy. Yeah, as of today, we do have 14 confirmed cases. Our initial case was identified on the 24th of March. Since that time, throughout our contact investigations, we identified 40 close contacts across the state of Ohio, 33 of which were identified residing within Knox County.
So it was 40 across the state, then it got down to like 30 or so in your county.
That's accurate.
Okay, and so that's why we've seen sort of the numbers jump, it seems, almost exponentially.
That's correct. As we know, measles is highly contagious, especially for those that are unvaccinated.
And so could you talk about that? Is that what you're seeing in these cases? Are these mostly unvaccinated people? Did they travel out of the country? What can you tell us?
Yeah, so all 14 cases throughout the investigation have been determined that they have been unvaccinated. The international traveler was the primary source that started our investigation within our jurisdiction. So as we continue to monitor, it's imperative that we educate individuals the efficacy of MMR and the importance of protecting ourselves and our vulnerable populations, especially those that maybe have some additional chronic illnesses.
What else are you telling the community there in terms of how they can stay safe? We're hearing a lot of people don't want to get their children vaccinated. What are you doing? How much more challenging, I should say, is that making the work that you do at the public health department?
Sure. Yeah. At the end of the day, it's individuals' right and their decisions to make that. And please understand that I fully respect that. However, all I can do is urge individuals to truly educate themselves through reliable sources, to speak with their primary care, their pediatricians, and come to their own conclusion. The MMR vaccine has been around for 60 plus years. And as we have seen over the duration of those years, is the efficacy of MMR. And it's very evident that the ability for us to combat measles in the manner that is most proactive and safest is to be vaccinated. So is it a challenge, Tracy? Without a doubt. It is definitely a challenge. And social media platforms that are out there and misinformation that are being provided to these individuals, all I can do is encourage them to truly speak with their primary care providers and draw their own conclusions, because it's evident. We have years and years of evidence to show the efficacy of this vaccine. And if we truly want to get out of these outbreaks, we have to do a better job collectively to increase our vaccination rates.
And I'm just wondering, is this your first time dealing with measles? Because for so long, many thought it was eradicated.
Sure. Yeah. No, unfortunately, Knox County had an outbreak back in 2014.
What are you talking about with your peers in surrounding counties? Because Knox County is sort of in a sweet spot, or the heart of counties here in Ohio. In central Ohio, many people can drive through there.
Yeah, no, it's maintaining common operating picture, not just with our stakeholders locally, but with our community partners outside of Knox County, to ensure that, if there's any potential contacts that are on the other side of a border, that we have those discussions. But the biggest thing is, Tracy, at the end of the day, we have the tools necessary for this not to be an ongoing threat in our community. And I can't stress that enough.
You seem really passionate about that. What else can you do to get the word out? Do you have your contact tracers out there, educators? What else are you all doing?
Yeah, so we're also working with other stakeholders in the community. We do have contacts with individuals in different areas that are populations that are difficult to get a hold of, especially in a rural community. And we're setting up points of distribution in those rural areas to ensure easy access to that vaccine, and reliable sources in the community that don't necessarily have a title, and understanding that people trust them. And we continue to have those conversations and educate them so we can do our best, not only to spread accurate information, but to create an access to that vaccine, or even medical care for that matter, right? It takes a village, like anything else. So we definitely work outside of silos in Knox County. We leverage each other's resources.
I love that. I was struck by what you said, reliable sources who don't necessarily have a title. What do you mean? Who are those folks?
So all our first responders, community partners that maybe are just well known in their specific areas in the community, that hold positions that are outside of the world of government, but people tend to follow and trust. And you can kind of break some of those potential barriers by knowing that so-and-so and X part of the county, we've known them, they've been a family member in this community for decades, And you just try to bridge that communication that, hey, look, we're not forcing this on anyone. It is, hey, we want the best for you, your family, and for you to make the most informed decision possible. And we'll do whatever we can to make that a reality.
We know how contagious measles is, and I know that your news release said that these folks are in isolation. What do you think that means in terms of kind of putting an end to this there in Knox County?
I'm pleased to say at this given point in time, with those contacts, we do have the area contained, but that information is only valid as the investigation that individuals are willing to bring the information forward. Maybe they're not wanting to be completely truthful, or come forward in regards to, oh, I had dinner at so-and-so's house and I don't want our friends, our family to have to quarantine or isolate depending on where they are. So there's only so much my team can do with the information that we have. So it is contained at this point in time, at least as of this morning, and we'll continue to monitor that hour by hour. But as you stated, the contagious component of this is that if you're unvaccinated, the likelihood of you contracting this virus, if exposed, is substantial.
So can you just, as we wrap this up, talk about how, when you think about how contagious it is, can you talk about how important you think it is to get the word out, in fact, talking with us so that we can also help get that word out?
Yeah, I guess for me, it's, our priority as a health district is the overall just health and safety of our community. By working together and following some recommendations that we're bringing forward, we can effectively control and be able to get out of this outbreak sooner rather than later. So again, I encourage you to come to the health department. We have providers on scene that can educate you, can have those discussions. Go to your trusted primary care physician. If you have a pediatrician, it's, as I started this conversation off, I just encourage individuals to find reliable sources to educate them to make the best decision they possibly can for them and their loved ones.
All right, Commissioner Green, thank you so much for talking with us today.